Or now it's not cool to cleanse in the morning because I think Salma Hayek said she doesn't use a cleanser in the morning.
So I personally cleanse in the morning, and I do recommend that most of my patients cleanse in the morning. A gentle, creamy cleanser. So for me, I do that for a couple of different reasons. Number one,
Welcome to the More Than a Pretty Face podcast, where we go more than skin deep to explore the science of beauty so you can feel your best at any age. I'm Dr. Azadeh Shirazi, a board certified dermatologist, and today I have a very special guest. If you've been on social media at all, you've probably come across the term skin cycling because it has over 1 billion hashtags on TikTok, and I'm going to sit down with the woman who coined the term. She happens to be a dermatologist, a research scientist, and a skincare brand owner and founder, Dr. Whitney Bowe. Hi, Dr. Bowe. How are you?
thank you so much for having me. This is so much fun. I love having derm to derm conversations. We're going to have so much fun today.
I always get the most excited when I have, especially female dermatologists. I feel like we can talk about so many different things, and I love to hear your take on things and sharing ideas and kind of what you're doing in your office. It's one of my favorite types of guests. So thank you so much for taking the time out of your busy schedule to join me.
Same, and it is my pleasure.
So, you're out in New York City. Tell us a little bit about yourself, kind of your journey to becoming a dermatologist and what type of practice you have, and yeah, what people want to know a little bit about you.
Yeah, absolutely. So I am a practicing board certified dermatologist. My practice has been capped for over 7 years now, meaning that I haven't been able to accept any new patients in that time. It's a very boutique, cosmetic, aesthetic practice. I treat a lot of faces that you'd recognize, TV personalities, Grammy Award winning musical artists. And whether I'm holding a syringe or a device, a laser, I'm also talking to my patients about what they're eating, how they slept the night before, how diet, sleep, nutrition can all impact the skin. So a couple of years ago, one of my patients said to me, "You're like a 3D derm." So the name kind of stuck. So I do take a very integrative and holistic approach, and so that's my clinical practice. But I also, do have a background as a research scientist, which you mentioned. So I've published over 40 peer-reviewed scientific publications, book chapters. I've lectured internationally. So I really do, love the science. I'm a complete nerd. And I also have a media presence. So I'm the go to dermatologist for Good Morning America. And as you mentioned before, very, very active, engaged social media community, which I absolutely love. And I know you do too. It just having those conversations and being able to reach so many people, especially because my practice is capped and, I can't take new patients. I love that interaction where I'm really helping people, empowering people, by debunking some of the myths out there and, delivering real evidence based information. How did I first get interested in dermatology? Well, in medicine in general, when I was 10 years old, I went to the Bahamas with my family, and I had conch chowder, and everybody got sick. But
What is that?
it's a chowder made from a shellfish, actually, and it's delicious. I'm a big fish lover. I love all things fish, but this one happened to have a parasite in it, and so I got very very sick, and my whole family got sick, but I wasn't able to recover. And so when I came back to the states, I was hospitalized and the doctors couldn't figure out what it was. They just assumed that it was a bacterial infection, right? So they started giving me broad spectrum antibiotic after broad spectrum antibiotic, and they basically decimated my microbiome, my good flora, all my
Oh,
good
wow.
bugs inside my gut. And I was left with a very severe case of C. diff colitis, which is something that happens when you're good, but there's always a balance, right, between your good bugs and your bad bugs. And so my army of healthy bugs had been basically decimated with all of the antibiotics, and so this bad bug was able to overgrow, and I was in horrific pain and really fighting for my life for an entire year. I was in and out of the hospital, and thank
Oh my God, how
goodness
traumatizing.
it
You were
yeah,
10?
I was 10, and it was very very challenging for my family. But I remember when I emerged from that situation, I really I thank goodness, I came out healthy. It took me a very long time to fully recover, but I really did emerge with this profound respect for the impact that your gut can have on your overall health and even the health of your skin. So, as a dermatologist, one of my first things that I did was to publish extensively on nutrition in the skin and how our diet, can actually impact our skin. Because when I was in training, I don't know about you, but I was taught, my textbooks, my websites, everything said that if a patient says that what they're eating, is impacting their skin, we were to debunk that as myth,
Yes.
and basically hand them a prescription for an antibiotic. But so I wrote this very controversial paper in our top derm journal at the time called Diet and Acne. And then I ended up, lecturing internationally. And now, thankfully, our textbooks have been revised. The curriculum that now the medical students are learning from very much takes much more of an integrative approach. And they are being taught that, certain things about our gut or our mind, our stress levels, our sleep habits, that, all of those things actually factor into our skin health. So that was a little bit of my journey and my background, how I became so passionate about, not only medicine, but specifically taking this more holistic and evidence-based approach to the skin.
I love that. I share your enthusiasm for that because it's very easy as physicians to just, write a prescription and hand it out. And I think we should be treating the entire person as a whole. I don't know about you, but I also like to know their habits and what they're like, their personalities, what they will and will not do, because that obviously also, as you know, will play a role in what kind of treatments and whether that treatment's going to be successful or not. So, well, I love your passion. You're such a superstar. I feel like so many women dermatologists are so inspiring. You do so much, and you have a family and all of this. So very inspiring. Now, now tell me, the skin cycling. Let's get back to that because a lot of people may not know what that is. Look, can you just briefly explain what that is and how you came up with that
Of
term?
course, so skin cycling is a deliberate strategic approach of cycling through your evening skincare in order to really drive results in the skin but minimize irritation. So it sort of takes a less is more approach to the skin. When I was treating my patients time and time again, I realized that so many of my patients were taking what I call a kitchen sink approach to their skincare. They were, mixing, matching, layering different ingredients, and it ended up actually causing irritation rather than really driving results. And so when I started talking to my patients, I was thinking about, just what I understand and what you understand about, skin biology, skin histology, the mechanism of action of how these ingredients actually work. I started coaching my patients through the skin cycling method of actually breaking down the evening routine into what I call push nights and recovery nights, and cycling between these nights where you're pushing skin outside its comfort zone with very powerful ingredients, things like glycolic acid, retinoids. And then you're also building in recovery nights, nights when you can just focus on hydration, repairing the skin barrier, rebalancing the skin microbiome. And when you cycle between those push nights and the recovery nights, you can really drive these very dramatic changes in the skin. And it was literally transforming my patient's skin. And so then when I presented it on social media, years after I started implementing it in my practice, it at first developed this cult following, and then it literally took on a life of its own, and it became, this mega viral phenomenon where, what I think is the most exciting aspect of it, because we know there's always trends that go viral on social, right? But this one in particular was adopted by so many experts. There were so many dermatologists and estheticians and true experts and scientists who were, getting behind this and really educating about it and explaining how to customize and personalize your skin cycling program. And for me, that was just, it was so humbling, it was so incredible to be seeing that and seeing people sharing their transformation, sharing their before and afters on social media. And it literally became a global phenomenon with, experts and dermatologists all over the world. Even just last week, Indonesia, Korea, there's so many countries that are still just almost like discovering skin cycling, for the first time. And those videos are still going viral, all over the world in different languages. And, it really works. And so it's been just an incredible journey, to see it evolve and see people be able to learn how to use skin cycling as a flexible framework to really sort of customize their skincare routine.
Yeah, I love that you simplified it. And you're right, a lot of people don't have access to a dermatologist, and so they're relying on influencers that don't see patients like you and I see patients. So I think it's such a strategic, simple way to start on a skincare routine that has really significantly impacted the skincare communities. Now, how long does it take for people to see results once they start skin cycling?
Yeah, so the classic cycle is a 4 night cycle, right? So night one is exfoliation night, where you use an exfoliant, a leave-on exfoliant, which, as you know, is going to dissolve away that uppermost layer of dead skin cells, but also prep your skin to get the most out of the next night, which is retinoid night. So night two is retinoid night, where you can use a retinol or a retinal, or you can use prescription strength tretinoin. And then nights three and four are your recovery nights, where you're sort of holding off on any potentially irritating actives like exfoliating actives or retinoids, and you're just focusing on hydration and repairing the skin barrier. And of course, that's skin cycling is not one size fits all, right? So that's the basic 4 night cycle, but we can always customize it to meet an individual person's needs and that person's goals as well. But if you start on a cycle like that, just to sort of see, how your skin responds to it before you start to customize it and tweak it, then it usually takes about 2 full cycles before you start to see a difference in the skin. You'll start to see that the skin just has more of a healthy glow. If you were experiencing any kind of irritation, it generally tends to calm down significantly. But of course, as you know, quality skincare takes time. So to see the maximum effects of skin cycling, it can actually take a couple of months. But I think in between, the most important step when it comes to skin cycling, between those first 2 cycles and the next couple of months when you really optimize those results, is using skin cycling to listen to your skin. Like if you're somebody who has eczema, very, very sensitive skin, rosacea, you may have to build in more recovery nights. You may not tolerate, a 4 night cycle. You may have to build in 5 nights, 6 nights where you're really building in extra nights of recovery. Meanwhile, if you're somebody who has oily, acne prone skin, or you're somebody who's acclimated to a retinoid, you may very well be able to build in many more retinoid nights and really drop those recovery nights and really level up to a much more advanced skin cycling program. So, yes, if you stick to a skin cycling program for a couple of months, you will see the most dramatic results. But the most important thing is to really think about it intuitively and use this flexible framework, this basic cyclical structure to figure out, like, okay, what's the best skin cycling program for my skin, and then stick with that over time. And that's going to really drive the results.
So really, I love that you said it's a framework, right? It's not a one size fits all and you can customize it. So let's go through, like, if you had somebody with, you mentioned sensitive skin, maybe somebody who's eczema prone, what kind of exfoliant would you have them do and how many nights of this? How would you tweak the cycle for them?
Right. And this is coming up a lot right now because it's in the winter. A lot of my patients are perimenopausal, menopausal. Their skin is so dry, it's so sensitive. So the way that I'm coaching them through skin cycling right now is more of a gentle skin cycling program. So what they do is they would cleanse, they would pat dry, and then they would use a gentle exfoliating product. And gentle doesn't mean that it's not effective. Like you can actually have a well formulated, as you know, exfoliant that's both clinically proven very effective, but also clinically tested on sensitive skin and well tolerated by sensitive skin. It really comes down to the formulation. So you can absolutely use a leave-on product. Ideally, look for one, that doesn't sting or burn. If you put it on and it feels like it's irritating the skin, then wash it off immediately. It means your skin's not ready for that formulation. And I always prefer chemical exfoliants over physical ones, especially for sensitive skin. Those gritty scrubs.
Now, why is that?
Yeah,
Tell
yeah.
us
So for a
tell us
couple.
about that. Chemical versus physical.
So if you use a physical scrub or a manual scrub, those are ones that feel gritty. They almost feel like sand, right, between your fingers, and those can actually, be much more traumatic to the skin. So they can actually sort of, really rub and irritate the sensitive skin. It's also very user dependent. Some people will rub certain areas harder than others, and you'll get this sort of uneven, sort of exfoliation that can be very irritating and leave the skin feeling dry and itchy and blotchy. Whereas with chemical exfoliants,
What about, you mentioned that friction and that scrubbing, and how does that affect certain skin conditions like acne? Because a lot of people think, I got acne, I got to scrub the acne away.
So that is one of the most common mistakes that people with acne make, is that they think that it's a hygiene issue and that they just have to scrub their acne clean. And then, if they get rid of all of that debris and oil and buildup on the skin by scrubbing really hard, their acne is going to clear up. But we know now that actually your skin barrier health is very important when it comes to clearing acne. And so you actually don't want to traumatize the skin. You want to respect the skin barrier. So, and the more that you respect the skin barrier, the more your skin's going to be able to tolerate very powerful actives like exfoliating acids. In the case of acne, I love salicylic acid, but I also love retinoids for acne. And if you're damaging your skin and you're scrubbing your skin or you're rubbing your skin or you're using a brush or a loofah or a buff puff, then your skin barrier is going to be vulnerable. It's going to be compromised and you're not going to be able to really tolerate those powerful retinoids that are going to drive that dramatic change in your skin. Another common
So lay off the buff puff if you're got sensitive skin or eczema or
the buff puff, no matter what kind of skin you have, let's be honest, but also especially if you're prone to hyperpigmentation or melasma, that's also one of the biggest issues that I see is people rubbing and scrubbing and they're making their dark spots worse. So, those manual scrubs for the face especially, I'm just not a fan. Like if you want to use them, on your heels, every now and then on your body,
I was gonna say
it's
feet.
okay to use them on your feet, exactly. But I am for your face. I am not a fan of physical scrubs for sure. Also, just think about they're not going to give you the same effects in the long term. If you use an exfoliating product that contains an ingredient, say like glycolic acid. Glycolic acid, we know based on studies that 8% or higher glycolic acid in a leave-on product can actually stimulate collagen synthesis. So if you're using a scrub, you're never going to get collagen synthesis, right? You're never going to get firming of the skin. A lot of the chemical exfoliants that we use, the alpha hydroxy acids, the polyhydroxy acids, they're excellent for brightening dark spots, right? Right? Getting rid of and helping with hyperpigmentation and dark spots. Those are things that scrubs are not going to do. What are scrubs going to do? They're literally just physically scrubbing off the dead layer of cells on the top of your face. That's all they're doing. If you do it too much, they can harm your skin. But a chemical exfoliant that's well formulated is going to not only give you more even exfoliation, more gentle exfoliation, but it's going to give you long term benefits. It's going to firm the skin. It's going to potentially stimulate collagen synthesis. It's going to brighten dark spots over time. So, why not build in those kinds of ingredients into your skincare routine over a scrub?
Yes, I agree. And let's talk about that a little bit because I don't think a lot of people realize that, formulations with glycolic acid actually send signals right down to the dermis to stimulate that collagen. So it goes beyond just removing the dead skin layer, but there is some cell mediated response from these chemical exfoliants to fibroblasts in your dermis to stimulate collagen and help with cellular renewal, which a lot of our skin cells get lazy as we age. And so we do need that cellular renewal process, which chemical exfoliants give us. Now, sorry, we went down on this tangent. Let's get back to the question at hand, which was how would you change the routine for somebody who has sensitive skin?
So, sensitive dry skin. So, night one, use a chemical exfoliant, ideally some kind of a triple acid blend, alpha hydroxy acids, beta hydroxy acids, polyhydroxy acids, ideally in a leave on formulation, because that's going to be more effective than a wash off formulation. And then you want to put on a moisturizer on top. Now, night two is going to be your retinoid night. So, a lot of my patients who have dry, sensitive skin, they have trouble, when it comes to tolerating prescription strength retinoids. They don't do as well with, say, a prescription strength tretinoin or Tazorac. Sometimes it leaves them, with dry, irritated, flaking skin, stinging skin, sensitive skin. So for my patients who have more sensitive skin, I do usually recommend either retinol with an OL or retinal with an AL. And I find that those are actually better tolerated in people who have sensitive skin. And then again, you can put a moisturizer on top. And then we build in recovery nights. So for my very sensitive skin patients, I have several patients who have eczema, rosacea, and they actually benefit from multiple recovery nights back back to back because they want to be able to use those exfoliating products. They want to be able to use that retinoid. But if they use them every single night, they find that their skin gets very irritated, it gets inflamed, it gets dry, it starts to sting. And so for them, they do better if they add in two, three, sometimes even four recovery nights where they're using just a hydrating serum, maybe one with peptides, hyaluronic acid. Then they follow with a moisturizer with ingredients like squalane, ceramides, prebiotics, postbiotics. Maybe they even layer something on top, what I call a finishing layer, which can be either, we talk about slugging on social media all the time. Some people love slugging, they love throwing, Vaseline all over their faces. I'm not one of those people, but there are other semi occlusive products, that you can use on top as a finishing layer. One of them, for example, La Roche Posay, the Cicaplast Balm, has gone mega viral. And that's a great sort of top layer, right? Just to put on those dry, irritated spots. You don't even have to put it all over, but if you are getting inflamed in certain spots, it can be a nice additional layer. Layering is so important during the winter, or if you have very sensitive or dry skin, just adding those extra layers of hydration can really be incredibly impactful at helping, to restore that skin barrier and really add that moisture to the skin.
So I love that. Let's talk a little bit about layering because I love layering in the winter months too. And you had mentioned, adding a serum and then, going a little bit thicker with each layer. What's a maximum number of layers, and do you have any sort of your own hacks for uh soothing dry skin in the
Yeah,
winter?
I always think if I'm getting higher than, 5 or 6 steps in any of my skincare routines, morning or evening, like for me, that's one too many steps. Like I usually try to stick to about 5 or 6 steps max, and that includes cleansing. So for me in the morning, I'll cleanse, I'll pat dry, and then I use my own vitamin C serum. It's called my Asta C serum, which I formulated to be incredibly hydrating. So it's 15% of vitamin C, but it's two of the more powerful, stable forms of vitamin C, which are less irritating. Because in the past, as you know,
Is that the tetrahexyldecyl or THC? Yeah, I love
tetrahexyldecyl
it.
sorbate,
Yeah.
exactly. It's tetrahexyldecyl and 3-O-ethyl ascorbic acid. It's a combination of those two in a 15% concentration. So, in the past, we used to be using and relying primarily on L-ascorbic acid as vitamin C. Like the L-ascorbic acid was the gold standard when it came to vitamin C. But as you know, L-ascorbic acid is a diva ingredient of vitamin C. It's the most active form of vitamin C, but unfortunately it's very unstable. It breaks down in sunlight, it breaks down in heat, it breaks down if you have too much oxygen exposed to it over time, and also it requires formulation at a very low pH. The pH has to be under 3.5 for that L-ascorbic acid to be stable and active, and consequently if you have dry sensitive skin and you put on those products, oftentimes my patients, it would start to sting right away. It would start to leave them with red patches, or some people simply can't tolerate that ingredient. And so, I wanted all of my products to be formulated for very sensitive skin, and I clinically test them on sensitive skin. And so my Asta C is not only very, very hydrating. So for me, it doubles as like a hydration step. It gives me that extra hydration under my moisturizer, but it's also got that 15% of the vitamin C. And we actually just published in a top peer-reviewed journal. It really does brighten the skin and firm the skin over time. So that's my first layer, morning and night, all winter long for sure. And then I put on my Boglow cream, which is my moisturizer. And then in the morning, I'll put on the Beauty of Joshan sunscreen. I find that one is wonderful during the winter. It's a Korean sunscreen. I get it on stylevana.com. It's like $10 to $12, not going to break the bank, but it's beautifully formulated in that it really does give me a little bit of extra hydration, but it layers beautifully underneath makeup, underneath foundation, and then after that, if I'm wearing foundation that day, then I layer foundation on top of it. And for my dry skin, that's actually that it dives into my skin. I don't feel like it's greasy. I don't feel like anything's sliding off of my skin, but my skin feels hydrated and protected all day long. So that's my typical morning routine. And then in the evening, yeah.
Now, some people say skip cleansing in the morning. Do you have a comment on that? I know that that's kind of been something that I've seen on social, where now it's not cool to cleanse in the morning, because I think Salma Hayek said she doesn't use a cleanser in the morning.
So I personally cleanse in the morning, and I do recommend that most of my patients cleanse in the morning. A gentle, creamy cleanser. So for me, I do that for a couple of different reasons. Number one, I sleep with a silk sleep mask on my eyes, so I like to block out all the light. When I wake up in the morning, I have crust on my eyelashes. If I don't use a cleanser, if I just splash my face with water, that crust is still on my eyelashes. And that's just not a good look. So, and it's uncomfortable. So I want to wash away the crust. The second reason that I cleanse in the morning is that I do apply skincare at night, whether it's an exfoliating serum or a retinoid or whatever layers I'm using at night. I want a fresh start in the morning when I'm going to be applying my morning routine. I want my vitamin C serum to dive into my skin and get where it needs to go to deliver the results. So I do want to gently wash away and cleanse away any of the skincare that I put on the night before. Now, do I need an aggressive cleanser to do that? No. A gentle, creamy cleanser that's non-stripping, that doesn't leave my skin feeling tight or dry is all I need in the morning. And it's a quick step, but I absolutely feel better about starting my day that way.
I love that. I love that. So I agree. I mean, I also use a creamy one in the morning because I think about like, I don't know, you drool or like, you sweat. It's been like several hours, a
Yeah.
long time. So, but I guess, whatever works for people, I respect that. So let's talk about the Bow Glow because you are known for this term. Tell us a little bit about that and how you came to coin that for your practice. I love that. That's so cool. And yeah, I couldn't agree more. I think so many people rely on injectables that they forget that there's actually skin quality, the skin cells, and a lot of people underestimate the power of skincare. And I try to communicate that with my patients too, that you're investing all this time and money in the office, but you got to do your part at home. And that really comes down to really good skincare products. Now, we both have skincare lines, and I have some of your products, which I'm so excited to try. The exfoliation night, and I love that you have the labels on your products that tell you what night to do what. Your exfoliation night, and we got the Bow Glow here, which love it.
That's that's sold out twice since we launched our Bow Glow cream. That was what I actually started with because for me, a really good moisturizer is the foundation of your skincare routine. But yeah, I mean, skincare is huge, and I became very, very passionate about it, and have seen tremendous results in my own skin and in my patient's skin. But I think that one of the biggest sort of controversies that's happening on social media, aside from people saying don't wash your face in the morning, is also this concept behind medical grade, science backed, clinically proven. Like, what do those terms mean when it comes to skincare? And I think that I personally really thought so hard about those terms because for me, not only as a practicing dermatologist, but my background is a research scientist. I did the research track as part of my residency. I took courses in logistic regression and at the Clinical Center for Epidemiology and Biostatistics. I mean, I really focused on basic science and epidemiological research and clinical studies. And that's something that's very important to me, is that if I'm going to make a recommendation, I want to really have it backed by true science that's of the a quality and a level of integrity, that I can really stand behind. So, for my products, what I did is I decided to use the term clinically proven. I thought that for me, was a term that I felt comfortable with, and my definition of clinically proven is that I test the final formulation of every single one of my products. So, I don't rely on what's called ingredient supplier data. A lot of brands out there, even if they appear to be very science backed, they'll look at one ingredient in the formulation and then they'll make a lot of claims based on that one single ingredient, right? Like, if they have ceramides in their moisturizer, they say this is going to repair your skin barrier. But unfortunately, you know that the ingredient is not the same thing as the final formulation. If you test one single ingredient at 100% concentration in a study, and you see one result, that's not the same thing as putting that ingredient in a blend of different ingredients and using that directly on the skin. So, when I wanted to do clinical tests, I wanted to do it on the final formulation. So when I say that something repairs the skin barrier, we actually do independent third party testings. They're very unbiased and unbiased setting with controlled temperature, controlled humidity, controlled lighting, and we'll use instruments. In this case, something called a tuometer is the actual clinical tool that can measure transepidermal water loss, which can actually show a statistically significant improvement in the skin barrier function. So, when I say it repairs the skin barrier, we use a tuometer. We use a corneometer when we say it increases skin hydration. When we say it increases the diversity of the skin microbiome, we actually do next generation sequencing technology and partnered with the top PhDs internationally in order to execute those studies. We'll use a colorimeter, we'll use an expert grader, like we'll use objectively measured assessments to quantify changes in the skin and actually see if they're statistically significant. And then we submit those results to peer reviewed publications. And we've already been accepted to top journals with our studies. So that's the level of science that I'm comfortable with, and I use the word clinically proven to describe that. But I know on social media right now there's a lot of people starting to question a lot of these brands that'll say that they're medical grade or science backed, because what does that really mean? And it can be so complicated for a consumer.
Yeah, I agree. I think as dermatologists that have skincare brands, it's really important to test the actual product and not just rely on ingredients, because people say, well, this must be the same as this product because it has this in it, and so does this product. Well, it goes beyond that. It goes beyond the formulation, like you said, like for example, some of my products, we've actually done skin samples. We've taken biopsies of patients and looked at them under the microscope to see the true results and some of the measures that you mentioned. I think that really is what defines, clinically proven or scientific skincare. But it gets the jargon can get really confusing. I think it's important to test some of these products and do some of these unbiased studies and publish them in peer-reviewed journals, like you mentioned. I also want to ask you about skincare in 2024. Do you see any trends or treatments? And we talked a lot about skincare. Now, what about in-office treatments or procedures in dermatology or trends in dermatology that you foresee kind of becoming more mainstream or more recognized in 2024?
Well, I think it's certainly worth addressing exosomes. I feel like there's so much buzz around exosomes right now. And that's
Are you doing it in your practice?
I am not. So I am one of those people who, if something, I'm not a cowboy. I really don't like to use myself or my patients as guinea pigs when we're still really exploring something that is a little bit new on the scene. I've been around a long time. I'm already at the point where I don't need to sort of adopt technology to draw new patients in, because I can't even accept any new patients. So for me, it's more about like, is this really going to dramatically improve what I'm currently offering in my practice, and what's the safety behind it? And for me, I think exosomes hold tremendous potential, and I don't criticize other doctors for being earlier adopters than I am, but I am a little bit cautiously optimistic, a little bit skeptical, and I want to see how this evolves and how it develops. So, for those of you who are listening, you're like, what are exosomes? So they're basically like little nanovesicles, right? They're little tiny like messenger pockets, that are communicating between cells, and they're being harvested from a number of different types of human cells, including fat cells and platelets, and they're being processed in very different ways. Sometimes they're being processed through ultrafiltration, ultracentrifugation. The different types of processing is very impactful as to whether those final products are actually even stable when you use them on the skin. And also, depending on the cell type that you're harvesting them from, there are some controversial studies, right? Some of them are showing that some exosomes can stimulate inflammation. Some exosomes can potentially cause tumorigenesis or cancer, promote cancer cells and their growth. And I don't want to fearmonger, but I also just want to acknowledge the fact that this is very new, and we don't have tremendous science behind this and how it's really going to benefit the skin. And from what I understand, it's not even FDA approved at this point to be injecting, exosomes. And I know, that's something that's.
Right. Yeah. Well, it's illegal to inject exosomes in the US. Now, I know I hear people are doing it. I'm with you on that. I don't think we should be injecting it, but I think applying it maybe after resurfacing or something like that, just to kind of get some personal experience, just to see, what the buzz is, would be acceptable. It's certainly, so we talked about skincare, exosomes in skincare. Do you have an opinion on that?
Yeah, I mean, I think that there's one company out there. I'm sure you've heard of them, Ryan, Plated, that I think is doing a very good job. When it comes to using the right processing and extraction techniques. And again, I think that it's one of those things that's very new. I think that just because it says exosomes on the label doesn't mean that it's very high quality, that it's very pure, nor that it's very stable. We know from formulating, retinal, for example, retinaldehyde or retinol, that just because the ingredient is on the label doesn't mean that it's stable and active by the time that it's hitting the skin, right? So much of it goes into the nuances of how you're actually formulating these powerful ingredients. And I think that exosome is going to be very, very complicated in terms of the creating that very stable, potent form of exosomes that is going to deliver the results that we expect it to deliver on the skin. Do I think it holds tremendous promise? Absolutely. And do I think that some of the companies are really investing, in the right way to really create, that kind of data? I do. But I think it's one of those things that, each you have to go to a brand that you trust. I think that's one of the reasons why, dermatologist founded skincare brands are so successful right now. Your brand, my brand are exploding because people trust that we're doing our homework. We're not just going to go out there and throw a new ingredient on the label. We're going to make sure that that ingredient really is coming from a trusted source. We're going to do our own independent clinical testing, making sure that it's delivering the results that live up to the claims that we're making on those labels. So, I think that exosomes are very, very interesting. I think topical use is something I'm going to be much more comfortable with than injectable, as you said, for many reasons. But again, I think it comes down to the brand. If you came out with an exosome skincare product, like, I would trust that product, and I would probably ask you great questions and you would have great answers for me. But I think that there is going to be a lot of brands that are going to throw the word exosome on their products. And would I urge, the listeners out there to be a little skeptical and to make sure that they're asking questions? Yes, I do think it's really important to ask questions surrounding this technology.
I agree. I think one, it's exosomes in skincare. We're not even really sure if it gets absorbed. I think we still have some work ahead of us before really relying on the accuracy of exosomes in skincare. Now, I want to finish. I know you've got a busy day ahead of you, so I don't want to keep you too long, but I do want to play a game to finish off our episode, which normally it's a rapid fire question, but you're so brilliant. I want you to go into a little detail, or, we can sort of talk about some of these as they've been trending on social and online. So let's start with lash serums and fat loss. This I see all over social. What are your opinions now? What we use in our practice is Latisse, which is the only FDA approved lash serum, but a lot of them have prostaglandin analogs, and there's been a lot of talk about fat loss, around the eyes. What is your take on that? Is that a slay or a nay?
So for me, that is a slay if it's done correctly. So I agree with you. The prostaglandin analog containing lash enhancing serums, specifically Latisse, but there are other ones like Grande Lash and Revitalash that are actually very effective at growing lashes, thickening them, making them longer. However, they do carry the potential risk of periorbital fat loss, and I just did some recent videos on TikTok, Instagram. They all went viral because everyone wants to understand this, but it does seem to be reversible, meaning that when we do see this fat loss, if you stop using the product, it does seem to come back. It also does not happen in everyone. And so what I'm doing currently is I have some patients who swear by their lash serums. They'd much rather use the lash serums than use lash extensions, which can actually lead to a lot of trauma and loss of the eyelashes. So there's risks and benefits with everything. So I do have some patients who love their lash serum, specifically Latisse, and what we're doing is we're trying to again cycle between, nights when they're not using the Latisse and then nights when they're using it, and see what's the least amount of times that they can use it per week to maintain their results. And then we're carefully monitoring around their orbital rim and around, their eyes to see if we're observing any meaningful fat loss or side effects. And we're making case by case decisions. Is this something we want to continue? Do we want to do any kind of filler? Is it not worth it? Are we going to, stop using it? But that's where I stand right now.
Yeah, I agree. And honestly, some of these pictures that, I'm seeing of the fat loss, they were used by people that were using the drops in the eye. So we know that when you apply a serum or a product that goes into the eye, there's much greater risk of absorption and that causing some of those changes. But some of those people actually looked a little better, and some of the fat loss. And they're actually, I think some of the companies are going to use them for people who, for example, have fat bags and so forth. And it does help reduce that. But yeah, I think there's that balance where it's still very effective and can be used in a safe manner. And I love that you point out that it's something that you can monitor and adjust and stop if you see those side effects happening.
So Gua sha is a yay with the right expectations. So gua sha can be good for helping to mobilize fluid retention like malar edema underneath the eyes. It can be good for muscle tension in the masseter muscle if somebody's experiencing TMJ symptoms. It can be good for relaxing the glabellar complex or those muscles around, the frown area, but is it going to replace Botox? Absolutely not. Is it going to reshape and recontour your cheekbones and your jawline in the long term? Absolutely not. Is it going to temporarily help to define, your jawline and your cheekbones? Yes. And over long term, is it going to help relax the muscle tension in certain muscles that may be giving you, if you're a clencher, if you're a grinder, if you've got TMJ symptoms, can it be very beneficial? It can. So, if it's something you enjoy, go for it. For me, I find it incredibly time consuming. And I don't think that the long-term benefits are worth the time investment for me. So I personally don't engage in gua sha regularly, but for my patients who, find it to reduce stress and they feel like it's a form of self-care and they feel like it is, helping with relaxing certain areas of muscle tension or, helping to mobilize some of that extra fluid, go for it.
Yeah, I do think that, just moving some of that fluid out from this central area that kind of contributes to the jowls, it could be helpful. But I agree. It doesn't do anything long term, but it is a quick fix for lymphatic drainage. What about facial steaming? Slay or nay?
So I have a YouTube video on this that's probably one of my most popular videos. I'm not a fan of facial steaming. So a lot of people think that facial steaming is going to detox their body. As we know as medical doctors, your liver and your kidneys are much more effective at, taking toxins out of the body, and, you don't really sweat your toxins out of your face. And also, I think a lot of people are confused between the difference between their sweat glands and their pores. And the pores are connected to their sebaceous glands or their oil glands. So your pores aren't doors. I think that a lot of people are under this misconception that you steam your face and your pores just open up and then you put on a cool wash.
Pores aren't doors. That's right.
They're not doors. They don't work that way. And also with steaming, a lot of my patients who have rosacea, who are prone to melasma, have found that when they stop getting facials that include steaming, or when they stop visiting, a sauna or in a place that has steam, their skin dramatically improves. So, if you do have rosacea, if you do have hyperpigmentation or melasma, I would say steaming is probably not good for you. If you don't have those conditions and you just enjoy it, again, it's something that you really enjoy and love and feel like it's beneficial, go for it. It's probably not doing too much harm, but I think you just got to know what you're getting into, because it's certainly not opening up all your pores and letting all those amazing ingredients penetrate, in a way that they wouldn't if
Yeah,
you weren't steaming.
it certainly helps loosen up things. I agree. But yeah, if you've got melasma or rosacea, that heat is definitely going to work against you. Okay, what about Skin Vive, the new injectable hydrator that's supposed to give you glass skin for 6 months? Are you doing this in your practice?
So I've been studying it, and I haven't officially started offering it in my practice yet, because I want to see how it compares to things like radio frequency microneedling plus PRP, Fraxel resurfacing, and really good skincare. So I'm very curious to see where this one lands. I'm interested, but I'm not jumping just yet. What about you?
So we have it. Again, same thing. I think that it definitely has a place in the practice, and we have had some really happy patients with it. But it's one of those things that I think if you are feeling like you're lacking hydration, despite doing skincare and some of these other treatments that you mentioned, it would be a good, adjunct therapy to look into. And then lastly, slay or nay, snail mucin.
So snail mucin, I think, is something that you can include as a humectant primarily. I think that some people are making the claim that it's going to do a lot of other things because it has a gamish or a blend, if you will, of different ingredients. For example, people will speak to antimicrobial peptides and zinc and allantoin and all these different amazing ingredients, glycolic acid, in there, and they'll say like, oh, it's doing all these amazing things for wound healing and collagen stimulation. Primarily, snail mucin, the primary mechanism of action is as a humectant, because the main ingredient in there is really going to be the glycosaminoglycans. We know that hyaluronic acid is a glycosaminoglycan, works very similarly to that, right? It works sort of like a sponge. Does it have some of these other active ingredients in there that could potentially have other benefits? It does. Do I think that the glycolic acid in snail mucin is going to replace your exfoliating serum anytime soon? No. I mean, the concentrations of those other ingredients are much more likely to be very low. I do think that there are some interesting studies behind snail mucin, and I think if your skin is dry and you want an extra hydration step underneath your moisturizer to help, act like a water magnet and just plump up the skin, and you're not a huge fan of hyaluronic acid serums, I think it's a great option. But do I think that it's, the retinoid? No.
Now, if you were as a skincare brand founder, if you were to bring on snail mucin as part of your line, would you have it synthesized in the lab, or would you go out and farm some snails and, form your own little snail farm and extract it?
So, I mean, I think in general, the future of skincare is going to be really biotech fermentation. I think that, I have a background in microbiology, and I'm completely intrigued by this idea that, really the most sustainable way to create high quality, powerful ingredients that are in their purest form and created in the most sustainable way that does the least damage on the planet is going to be through biotech fermentation in a laboratory setting. I think think that some ingredients are amenable to that and some are less amenable to that. But wherever we have the option of doing that, I think I would do that more from a sustainability point of view. Do I think that the snail mucin is, I think that there are cruelty free ways of collecting snail mucin directly from the snails. And I believe most of it is being, collected in Korea. And I think that they are using cruelty free, ways of collecting that mucin. And from what I understand, if the snails are traumatized or fearful or scared, the quality of the snail mucin is compromised. So they're actually incentivized to keep these snails very happy in these little dark, calm, cool environments where they're just walking around, depositing their slime. So I think that snail mucin, the way that it's being currently, collected is probably pretty ethical. It's probably cruelty free. But for any ingredient, whether it's squalene, any of these ingredients, the future, in my opinion, is going to be looking for renewable ways or the least damaging to the planet. And for me, that's going to be through biotech fermentation.
Yeah, I agree. And so much cleaner and better for the planet. There's always this risk of contamination when you're doing this, extracting it in a natural way. So, well, thank you so much for joining us today. It was so fun talking with you. I learned so much from you. I'm so inspired by you. And I want to have you tell the audience where they can find you, what your website, tell us a little bit about your skincare brand and where they can look for that.
So my website is drwhitneybobeauty.com, and I have all my products there as well as tons of educational resources there. And then on Instagram and TikTok, I'm at Dr. Whitney Bow. The brand channels are at Dr. Whitney Bow Beauty if you're specifically interested in the products. And then I've been focusing a little bit more on YouTube, which has been really fun too. So it's just Dr. Whitney Bow on YouTube. But it's been such a pleasure to be here. Thank you so, so much for having me.
Yes, thank you for joining us. Bye, guys.